Millions of Americans suffer from migraines each year, and a surprising fact is that many of them are veterans. The National Headache Foundation is advocating for increased access and quality of care for veterans. I spoke to the foundation's executive director, Tom Dabberton, to find out more.
First of all, migraine is an illness, and it's a recurring condition. Migraines are very disruptive to one's life. It is tremendous pain oftentimes, but it can cause nausea, it can cause auras, it can really affect the entire body.
And you say 1 in 3 households?
1 in 3 households. There are about 42 million adults in the United States that currently suffer from migraine.
And they're often untreated. Or misdiagnosed.
They're often untreated or undertreated because, again, of a lack of understanding. It's one of the programs that the National Headache Foundation is promoting right now, which is a national training app that's available from either Apple or Android. And it really gives practitioners, primary care practitioners, all they need to know about treating migraine, how to treat it, how to prevent it, how to diagnose it.
Is it that people don't know what they're experiencing? Is that part of the problem?
Well, one of the problems is people feel that they've had this tremendous pain in their head, and they assume that they've just had a headache. But when those headaches continue to occur on a regular basis, it's probably a migraine. It's probably something that can be treated. And the great news is that there are preventative measures and acute measures to treat migraine. The bad news is that they're not properly diagnosed.
Oh, wow. And that's part of what the National Headache Foundation does. You are making people aware.
Absolutely. So we focus on 4 issues. We focus on awareness, advocacy, research, and education.
Are there people around the country that are properly trained on how to diagnose someone who's dealing with a migraine situation?
There are about 1,100 headache specialists in the United States. They're basically certified as headache specialists through 2 organizations, us being one of them. And we're also, as I said before, we're trying to train primary care practitioners, physicians, nurse practitioners, physician assistants, and others in how to diagnose and treat migraine. So it doesn't have to be treated in many occasions, it doesn't have to be treated at a specialist level. It can be treated at the primary care level if it's diagnosed and treated correctly.
All right. And it's also a major issue amongst veterans.
It's a huge issue amongst veterans. So about 15% of the adult population in the United States have migraine. That number is about 35% amongst veterans. And probably because of some of the exposures that they have. I mean, they're exposed to noise, to sleep deprivation, to interruptions in schedule, to all the things that can help trigger or magnify migraine. Unfortunately, the number is way too high, and so we have a program called Operation Brainstorm, which is an outreach to the veteran community, and we're planning on launching a number of listening sessions where we'll have headache specialists, headache leaders in the field, if you will, going out and conducting listening sessions during 2023 in about 20 different markets throughout the United States so that we can gather more information and we can also get those veterans some assistance.
But the good news is that it is a treatable condition and that there are medications out there that will help.
Oh, absolutely. There's so many different treatments available. And again, some of them are acute, so they're there to treat people during the onset of migraine. There are other treatments that are available that actually will prevent migraine from occurring.
All right, if you'd like more information on migraines or Operation Brainstorm, you can email the National Headache Foundation at info@headaches.org, or you can call the number there on your screen.